Dr. Oz, the Wizard of Healthcare Services, is bringing artificial intelligence to Medicare. Hello, I am Kevin Knaus, an independent health insurance agent in California, and I work with individuals transitioning into Medicare, looking at Medicare Advantage plans, Part D prescription drug plans, Medicare supplement plans. So I follow what's going on at Medicare. And Dr. Oz, who leads the Centers for Medicare and Medicaid Services, has announced a new model for prior authorization of certain healthcare services that will be utilizing artificial intelligence. They call it WISER, Wasteful and Inappropriate Service Reduction Model. And yeah, it's going to be using artificial intelligence, which we have seen being used with other health insurance plans, but now it's going to be introduced into Original Medicare, which has been pretty much Original Medicare is pay first, ask questions later. And now that looks like that's going to be shrinking. Now, this WISER model will be limited, and it's going to be introduced into the states of Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington initially. Okay? And it's not going to be all services from Original Medicare. It's going to be select services that CMS has said, hey, it looks like there's some wasteful procedures going on here that may be not effective. And they are going to be focused on skin and tissue substitutes, electrical nerve stimulators, and knee arthroscopy for knee osteoarthritis. And then here is a list of all of the healthcare services that will need review or will be reviewed within those states from providers, doctors, and some durable medical equipment providers that put in a claim to Medicare. Now, the CMS says that this WISER, they're going to have some measurements. They're going to be looking at the process quality, provider and supplier experience, clinical quality outcomes. So they're going to be reviewing it. You can also say that this is a test. Can we implement this? Is it working? Can we expand artificial intelligence? Now, the way this will work in these states is those providers that provide those services or that equipment, they're going to have a choice of how they interact with this. They can submit for prior authorization to have it run through the AI and the machine learning and then get an approval or a denial, or they can have their claim subject to post-payment or review. Was it wasteful? Did this work? But either way, Medicare is going to be looking at these services in those states by those providers. And as an incentive to those doctors and other providers from Medicare to kind of participate, they say that participants will receive a percentage of the reduction in savings that can be attributed to their reduction of wasteful or inappropriate care. So I guess if a doctor, was doing 10 procedures and he cuts back to 8, those other 2 are deemed wasteful, and so he's going to get some money on it. I don't know. It's like you're admitting, oh yeah, not all of my procedures were efficacious and effective. But anyhow, the timeline seems aggressive. They just announced this on June 27th. They want the request for, the quotations, request for proposals from the AI companies in by July 25th, because they want to launch this January 1, 2026. So fairly aggressive, we want to get this in place. And then supposedly this is going to run through 2031, at least that portion of it. But, they may expand it before that. So what is the driver? What is the justification for implementing this AI, to reduce waste? Well, it's all about money, at least from the CMS Dr. Oz perspective. And CMS in their fact sheet notes that 25% of healthcare spending in the United States has been deemed wasteful. Now, that number comes from an article written in 2019 and in the Journal of American Medical Association, where they looked at all healthcare plans and all authorizations for services and determined that 25% of those services were wasteful, meaning potentially maybe kind of duplicates, or it was a service that really didn't provide any benefit to the patient. Perhaps the doctor was just, churning out, dollars, getting claims. I got to do this procedure, so I get paid for it because I got to keep my doors open. I don't know. But of course, Dr. Oz, I'm going to cut waste. And that's what he has said. CMS is committed to crushing fraud, waste, and abuse, and the wiser model will help root out waste in original Medicare. Combining the speed of technology and the experienced clinicians, the new model helps bring Medicare into the 21st century by testing a streamlined prior authorization process while protecting Medicare beneficiaries from being given unnecessary and often costly procedures. So the emphasis is on saving money, not necessarily patient outcomes. But that's kind of where we're at in 2025. It's all about money. Now, who are the contractors? Well, there is just a plethora of artificial intelligence companies that will probably put in a proposal. And of course, we know they are using artificial intelligence in health insurance prior authorization now. And of course, United Healthcare uses faulty AI to deny elderly patients medically necessary coverage lawsuit claims. So yeah, there's some issues with artificial intelligence. And this company here, Thoughtful AI, they advertise themselves as eliminate prior authorization bottlenecks. They claim that, they can help reduce claims by 50%. And I don't think anyone disputes that there is some wasteful health care services and durable medical equipment that runs through commercial health insurance and original Medicare. And original Medicare, has been kind of a pay first, ask questions later. And, that probably needs to change. It probably needs to have some more scrutiny on it. Whether denying claims based on an artificial intelligence algorithm makes sense, I am not sure. But these contractors, they aren't employees of Medicare. They're a third-party contractor. They're for-profit. And now CMS goes out of their way to emphasize that final decisions that a request for one of the selected services does not meet Medicare coverage requirements, in other words, a denial, will be made by licensed clinicians, not machines. So that means that, prior authorization will come in, and then they'll get a piece of paper, and the clinician will look at it and say, yeah, that looks about right. It needs to be denied. Maybe? I don't know. The fear, which I think is justified, is that this program, hopefully successful, but maybe faulty, will be expanded to all original Medicare services across all 50 states. So a lot of stuff will be going through this AI prior authorization thing. And Medicare beneficiaries, a lot of complicated healthcare issues going on there. So hopefully AI will be able to factor all of those in, but it's hard to say. The other fear is that original Medicare will just kind of mutate into a Medicare Advantage plan, where many of the Medicare Advantage plans, HMOs and PPOs, already apply prior authorization through AI and other means for approving different procedures. And I believe you would still have the network of original Medicare across all 50 states, but I'm fairly certain that that this will be implemented wide scale, and it won't be as easy to get certain services under certain conditions. But we'll have to wait and see. The main thing is that you know that artificial intelligence will be squirted into Original Medicare beginning in January, specifically for those states that they're rolling out this model program for. And then we should probably look for it to go nationwide in the next year or so. If you have any thoughts or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I am Kevin Knaus.